If you are sitting down right now with a small white tablet in your hand, and you have been taking it every single morning for years, there is something that pill bottle is not going to warn you about. Something that can quietly undo the very reason you were prescribed the medication in the first place. And the frustrating part is this: almost none of it involves doing anything obviously wrong. It is the ordinary stuff. The grapefruit you had with breakfast, the ibuprofen you grabbed for your knee, the glass of wine with dinner last night, the supplement your neighbor swears by. Millions of older adults are taking this medication right now, and most of them have no idea these everyday moments are reshaping their blood pressure numbers without them realizing it. Amlodipine is one of the most widely prescribed blood pressure medicines in the world. Cardiologists reach for it because it works smoothly, lasts a full 24 hours, and most patients tolerate it well. It is used to bring down high blood pressure, ease the workload on the heart, relieve certain types of chest pain, and reduce the long-term risk of heart attack and stroke. For millions of people, it is doing exactly what it was designed to do. But here is what almost never makes it into that rushed 5-minute office visit. There are specific foods, drinks, habits, supplements, and timing choices that can quietly weaken amlodipine, push your blood pressure in the wrong direction, or amplify the medication far beyond what your dose was meant to deliver. And when you are over 60, your body handles medication differently than it did at 40. Your liver is slower to break things down, your kidneys are slower to clear them, drugs stay in your bloodstream longer, interact with more things, and the margin for safety gets smaller with every new pill you add to the routine. That is not something to fear. It is something to respect and to plan around. What surprises many seniors I talk to is that the conflict rarely announces itself. It does not feel like a medical emergency. It feels like a slightly more tired afternoon than usual, a reading on your home cuff that refuses to come down no matter how faithfully you take your pill, a wave of dizziness you decided was just part of getting older. Sometimes those things are just age. And sometimes, very often actually, there is a cause that is completely fixable once you know it is there. In this video, we are going to walk through 10 specific things to absolutely avoid while taking amlodipine, and we are counting down from number 10 all the way to number 1. The earlier items are important, but the later ones are the ones that quietly catch the most patients completely off guard. I want you to stay with me all the way through, because the very last one might just change how you think about every other prescription sitting in your bathroom cabinet. My name is Dr. Olivia Brooke, and for close to 2 decades, I have worked almost exclusively with older adults managing blood pressure, heart disease, and the everyday reality of being on multiple medications at the same time. I run this channel for one reason: to give you honest, practical, plain language health information that helps you stay independent, feel steady on your feet, and walk into every doctor's appointment with real confidence. Everything we cover here is grounded in published clinical research and real patient experience. We are absolutely not here to replace your physician. We are here to help you ask smarter questions when you sit down across from them. Before we start the countdown, I want to ask you something directly. Have you ever noticed your blood pressure readings changing quite a bit from day to day, even though you are taking your amlodipine faithfully? Maybe a little higher some mornings, or unexpectedly elevated after a meal you have had 100 times before. If that sounds like you, drop a comment below and tell me what you are seeing. You would be honestly surprised how many people in this community share the same experience, and how often the answer turns out to be hiding in plain sight. Let us count them down together. Number 10. Taking amlodipine with grapefruit or grapefruit juice. This one catches people off guard every single time, because grapefruit wears such a healthy halo. But grapefruit contains natural compounds called furanocoumarins, and these compounds block an enzyme in your gut called CYP3A4, the very enzyme your body uses to break amlodipine down before it enters your bloodstream. When that enzyme is blocked, more of the medication slips through than your dose was designed to deliver. The result is a blood pressure drop that can come on lower and faster than your doctor expected. And that unpredictability is exactly what makes it dangerous for someone in their 60s or 70s. The effect can linger for up to 24 hours after a single glass of juice, and it varies from person to person in ways we cannot fully predict. One morning after grapefruit, you might feel perfectly fine. The next week, the same amount leaves you dizzy before you have even finished breakfast. That is precisely why cardiologists keep this near the top of the avoidance list year after year. The good news is that regular oranges, clementines, lemons, and limes do not carry this risk. You do not have to give up citrus, just grapefruit specifically, and any supplement capsules that list grapefruit extract on the label. If grapefruit has been a regular part of your morning, please mention it to your prescribing doctor. Number 9, reaching for ibuprofen or naproxen on a regular basis. When your knees ache in the morning or your back flares up after gardening, grabbing a bottle of ibuprofen feels like the most natural thing in the world. These medications are sold over the counter, they work reasonably well, and most of us have been using them for decades. But for anyone taking amlodipine, regular use of these non-steroidal anti-inflammatory drugs creates a quiet but real conflict inside your body. NSAIDs make the kidneys hold on to sodium and water. That extra fluid increases the volume of blood your heart has to push through, and that volume pushes your blood pressure directly upward, working against the very thing amlodipine is trying to accomplish. Multiple clinical studies have shown that consistent NSAID use can raise systolic blood pressure by several points in people who already have hypertension. And for someone whose numbers are already being managed on medication, those extra points can absolutely push them out of their safe range. There is also a kidney dimension to this. Amlodipine relaxes your blood vessels, including the small vessels feeding your kidneys. NSAIDs can narrow those same vessels, partially undoing the benefit. The two medications are essentially pulling in opposite directions, and your cuff readings will often reflect that tug of war. The safer everyday alternative for most older adults is plain acetaminophen, sold as Tylenol, which does not carry the same fluid retention risk. Topical gels like diclofenac gel work very well for localized joint pain with far less whole body absorption. If you find yourself reaching for the ibuprofen bottle more than a few times a month, that conversation belongs in your doctor's office before the next refill. Number 8. Drinking alcohol regularly while on amlodipine. This is an interaction that almost never comes with a sticker on the bottle, and yet cardiologists see it quietly shaping patient outcomes all the time. Amlodipine relaxes your blood vessels to bring your pressure down. Alcohol does something similar in the short term. When the two combine, your blood pressure can drop further than either one would on its own. For someone in their 60s or 70s who already notices a little lightheadedness when they stand up, that combination can raise the fall risk in a meaningful way. But the story does not end there. After the initial drop, your body rebounds by releasing stress hormones that push your pressure right back upward. Over time, that cycle of dipping and spiking makes your blood pressure genuinely harder to control, even when you are taking your medication with perfect consistency. You may have noticed your morning readings are unexpectedly high after an evening with wine or a cocktail. That pattern is not random. For women over 60 in particular, the effect tends to be stronger because the liver's ability to metabolize alcohol slows with age, and it slows faster in women than in men. If an evening drink has quietly become part of your routine, that is absolutely worth discussing with your physician. Moderation on a blood pressure medication simply does not mean what it used to. Number 7, taking amlodipine at a different time every single day. Amlodipine has what we call a long half-life, which is one of its real advantages. It stays active in your body long enough that you only need one tablet a day. But that does not mean the timing is flexible in the way many people assume. When you take your prescription, sometimes in the morning, sometimes after lunch, sometimes right before bed, the amount of active medicine floating in your bloodstream rises and falls more than it should. Amlodipine works best when it keeps a steady, even level in your system across the full 24 hours. Erratic timing creates gaps in coverage right when your heart needs protection the most. For most older adults, blood pressure has a natural tendency to climb in the early morning hours between 4 and 10 a.m. That window is also when heart attacks and strokes are statistically most likely to occur. Consistent timing helps make sure your medication has your back during those exact hours. The habit to build is genuinely simple. Pick one time and stick with it. Tie it to something you already do without thinking, like brushing your teeth after breakfast or settling into your evening chair. Set a phone alarm if you have to. If you do miss a dose, take it the moment you remember the same day. If the next dose is already close, skip that one and absolutely never double up. Consistency, not perfection, is what makes this medication work. Number 6, eating a consistently high sodium diet without realizing it. Amlodipine works by relaxing and gently widening your blood vessels, so your heart does not have to fight as hard to push blood through. But when your diet is habitually high in sodium, your body quietly holds on to more fluid, which increases the total volume of blood your heart has to move. That extra volume pushes your pressure back upward, working against the medication all day long. This does not mean a pinch of salt on your scrambled eggs is going to undo your prescription. The real concern is habitual high sodium intake from processed foods, canned soups, packaged snacks, deli meats, and restaurant meals, the places where salt hides in amounts that are easy to underestimate. A single can of soup can quietly carry more than 1,000 milligrams of sodium. A deli sandwich can approach 2,000. The generally recommended daily limit for adults managing hypertension sits around 1,500 milligrams. Most people, even very careful ones, go well over that without realizing it. For someone whose blood pressure is being managed with amlodipine, a diet that regularly blows past that limit can explain exactly why the medication sometimes feels like it has stopped working. It has not stopped working. The dietary load is simply working against it. Reading the nutrition label before you put something in your cart is honestly one of the most practical habits you can build. If you are finding this helpful so far, before we keep going, I want to ask you to do something really small. Go ahead and type your first name, your age, and the country or city you are watching this video from, just down in the comments. It is a tiny gesture, but it genuinely lets me know this information is reaching the people who actually need it, and it helps this video find more of them. Thank you for being part of this. Number 5, taking herbal supplements without telling your doctor or pharmacist. This one is, in my experience, the most invisible problem in older adult medication management, and it shows up in my clinic almost every single week. Many older adults are doing everything right. They take their prescriptions faithfully, they try to eat well, and they have added a natural supplement they read about or heard a friend mention, something that supposedly supports heart health or gently lowers blood pressure. They do not mention it to their doctor because in their mind, the word natural has quietly become synonymous with the word safe. That assumption is medically incorrect, and the consequences are usually slow and cumulative rather than dramatic. St. John's wort, commonly used for mood and sleep support, activates an enzyme that speeds up the breakdown of amlodipine in your body, pulling your medication levels down and letting your blood pressure creep back up without anyone connecting it to the little brown bottle on your nightstand. Licorice root, found in some herbal teas and traditional remedies, raises blood pressure through sodium retention and adrenal stimulation, directly working against what amlodipine is built to do. High-dose garlic capsules have a real blood pressure lowering effect of their own, and combined with amlodipine, the combined drop can overshoot in an older adult who is already prone to dizziness. The fix is genuinely simple and takes almost no time. Before you start any new supplement, whether it is herbal, a vitamin, or something a friend gave you, bring the bottle to your pharmacist and ask them to check for interactions. A good pharmacist can often spot a problem in under a minute that might otherwise take months to trace back to its real cause. You deserve a complete picture of how everything in your routine works together. Number 4, ignoring ankle swelling that just will not go away. Ankle swelling is actually a known and relatively common side effect of amlodipine, especially in older adults. The medication works by relaxing your blood vessels, but that same mechanism can allow fluid to gently shift into the lower leg and ankle tissue, particularly after standing or sitting for long stretches during the day. Clinical data shows the effect is dose-dependent, ranging from a few percent at lower doses to a much larger share at higher ones. For many people, mild swelling is manageable and not dangerous. The real problem shows up when that swelling gets quietly dismissed as just something you have to live with, without ever checking in with a doctor. Because persistent ankle swelling can also be a signal of other things that need very different attention, including heart failure, kidney problems, or in some cases, a blood clot that needs urgent evaluation. If you are noticing that your ankles are consistently puffy by late afternoon, that your shoes feel tighter than they used to, or that pressing your thumb into your shin leaves an indent that takes a slow moment to bounce back, those are signs worth reporting and absolutely not just normalizing. Your doctor has options. Sometimes a small dose adjustment is enough. Sometimes switching to a slightly different formulation meaningfully reduces the swelling. Sometimes a low-dose diuretic is added to help manage the fluid. None of those options are available to you if the symptom never gets mentioned. Swelling that comes with shortness of breath, chest discomfort, or sudden weight gain deserves same-day attention, no exceptions. Number 3, stopping amlodipine suddenly without medical guidance. This one is serious, and it comes up more often than most people would expect. Someone has been feeling better, assumes their blood pressure has quietly resolved on its own, and stops taking the medication on their own terms. Or the side effects have felt uncomfortable, some ankle swelling, a little flushing, the occasional headache, and the patient decides to take a break without telling anyone. Or the prescription simply runs out and the refill gets delayed, and a few days without it feels like it cannot possibly matter all that much. With amlodipine, stopping abruptly can cause your blood pressure to climb sharply, sometimes to levels higher than before you ever started treatment in the first place. For older adults, that sudden spike carries real risk, including stroke and hypertensive crisis. Amlodipine works by keeping your blood vessels in a steadily relaxed state. When the medication is suddenly withdrawn, those vessels can respond with a rebound constriction that is more aggressive than usual as your body scrambles to adjust. And that rebound does not happen gradually. It can happen within days. If the medication is causing side effects that bother you, there are real options available: dose adjustments, formulation changes, alternative medications with different side effect profiles. But those conversations belong in your doctor's office before you stop, not after. Never discontinue a blood pressure medication on your own, ever. If cost is the barrier keeping you refilling on time, ask your pharmacist about generic options or assistance programs. A gap in coverage is far more dangerous than the alternative. We are almost at number 1, and this is honestly the most important item on the entire list. If you have stayed with me through the whole video, I would love for you to hit the like button, subscribe to the channel if you have not already, and turn on the notification bell so you do not miss the next one. It means more than you know, and it tells me this community genuinely cares about getting this information right. Number 2, combining amlodipine with over-the-counter blood pressure support supplements without telling anyone. Unlike herbal remedies sitting on the fringe, this category involves products that are actively marketed as blood pressure support. Things like magnesium supplements, CoQ10 capsules, omega-3s in very high doses, and beetroot extract powders. These are not fringe products. They are widely sold, heavily advertised, and genuinely used by health-conscious older adults who simply want to support the work their heart medication is already doing. The issue is not that these supplements are dangerous on their own. Some actually have real evidence behind them for modest blood pressure effects. The issue is the compounding picture when they sit on top of a full prescription dose of amlodipine without anyone in the care team knowing. Magnesium has a mild vessel relaxing effect similar to amlodipine itself. High-dose omega-3s and beetroot extract can also nudge blood pressure down modestly through their nitrate and anti-inflammatory properties. When any of them are quietly layered on top of your prescription, the combined effect can push your readings lower than your doctor intended, leaving you dizzy, more fatigued, or unsteady on your feet for reasons nobody can quite pin down because nobody knew the supplement was added 2 months ago. The danger here is not dramatic, it is incremental. Your numbers drift a little below your target range. You feel a little more tired than usual. No one writes it down because no one knew. Before you add anything marketed as blood pressure support to your routine, show the exact bottle to your prescribing physician. That 1 5-minute conversation can prevent weeks of unexplained symptoms and a fall you never needed to have. Number 1, combining amlodipine with certain other prescription medications without a fresh interaction review. This one sits at the very top because it is the most consequential and the most commonly missed in busy clinical settings. Older adults are very often managing several conditions at the same time: blood pressure, diabetes, arthritis pain, anxiety, sleep, cholesterol, atrial fibrillation, and each one can carry its own prescription. What does not always happen, especially when you see more than one specialist, is a thorough review of how every single medication in your lineup interacts with the others. Some commonly prescribed antibiotics, particularly clarithromycin and erythromycin, inhibit the very same CYP3A4 enzyme we talked about with grapefruit. During even a short course of one of those antibiotics, amlodipine levels can rise significantly, and the risk of an exaggerated blood pressure drop or troubling side effects goes up with them. Certain antifungal medications carry the same warning. Some HIV therapies, certain anti-seizure drugs, and even specific heart rhythm medications can quietly change how amlodipine behaves in your system. The challenge is that these interactions are not always flagged at the pharmacy counter, especially when prescriptions are filled at more than one location or prescribed by more than one office. The single most protective habit you can build for yourself is to use one pharmacy for every prescription you take, every refill, every time. And whenever a new medication is added, ask, out loud and directly, does this interact with my amlodipine? That question takes 10 seconds, and it can prevent a complication that would otherwise take months to untangle. We have covered 10 important things today, from grapefruit in the morning, to ibuprofen in the medicine cabinet, to alcohol with dinner, to herbals on the nightstand, to the brand new prescription from a different specialist. And if even one of these made you rethink a single piece of your daily routine, then this video has done exactly what it was meant to do. Amlodipine is a genuinely effective and very well tolerated medication for the vast majority of people who take it. The goal was never to make you anxious about every meal, every drink, or every bottle on your counter. The goal was to help you take it smarter, with more awareness of the ordinary, everyday things that can quietly work against it without ever announcing themselves. The most important habit to walk away with today is simple honesty with your care team. Tell your doctor what you actually eat on a regular basis. Tell your pharmacist exactly which supplements you are taking. Ask clear questions anytime a new prescription is added. Bring your actual pill bottles to your appointments in a bag if you have to. These are not complicated steps. They are small, low-effort habits that help your medication perform the way it was carefully designed to. Your blood pressure numbers are not just digits on a screen. They reflect the health of your heart, your brain, your kidneys, and your ability to stay independent, mobile, and sharp in the years ahead. Managing them well is one of the most meaningful investments you will ever make in your own quality of life. If this video helped you, please share it with someone you love who is also managing blood pressure, a spouse, a sibling, a close friend, a neighbor. You never know whose daily routine it might quietly improve. And if you have not already, please consider subscribing so you do not miss the kind of practical, plain language health information that can make a real and lasting difference in your day-to-day life. We create this content specifically for adults over 60 because you deserve clear answers, not medical jargon. Take wonderful care of yourselves. We will see you in the next one.